I mean, now with this global health emergency, does that change at all?
It does not change at all for Canadians, no. The risk remains low. Obviously, it is low because partly travel to and from the affected region and from China is becoming more difficult. And of course, we have a very sophisticated system here in Canada, which has been noted, by the way, by the World Health Organization as one that's extremely responsive and able to not only support people that may be under investigation for having the virus, but who are ill. Of course, we're going to put into place measures to protect Canadians who are in China, in the region, regardless of their situation, and that will be different for different needs. I mean, some people have not don't want to leave, but they need other kinds of supports and services, and so we'll work on a case-by-case basis with the Chinese government and with the Canadians that are in the region to support them in the best way possible. In terms of the World Health Organization's declaration of an emergency, a global emergency, public health emergency, what that means is that really in terms of Canada, we are actually up to date with the recommendations of the World Health Organization. I think there's an implication that we need stronger countries need to support the weaker countries in the world to prevent the further transmission of the illness in a global way. And that's very important for the health of all of our citizens.
I think that it's time for the government to get off their platitudes and their generalities and start revealing to Canadians what their specific plans are. One of the chief reasons for the WHO move is their concern that there are nations on the globe, around the globe, that do not have the capacity to deal with this virus. If you think about that, that's a very serious and significant concern. It means that we're not just concerned now about people coming from China or Wuhan province, we're concerned about people coming from countries all over the globe. They absolutely have to be quarantined at some point. When we know that the virus incubates for up to 14 days, we need to make absolutely sure that anybody who is getting on a plane with people that maybe are healthy can't infect them. And we have to make sure that only healthy people get on that plane. And the government's relatively, I think, moderate pace of behavior and reaction on this file is no longer good enough.